This video is on the topic of global health. What is global health? With justice and human rights as its foundation, global health is defined as the area of study, research, and practice that places a priority on improving health and achieving equity in health for all people worldwide. Global health is about worldwide health improvement, reduction of disparities, and protection against global threats that disregard national borders. It is not to be confused with international health or public health. Widespread confusion and overlap exist among these three terms. International health focuses on the health issues, especially infectious disease and maternal and child health in low-income countries. Public health, however, is usually viewed as having a focus on the health of the population of a specific country or community. Global health is also focused on people across the whole planet, rather than the concerns of particular nations. The ultimate goal of any global health endeavor is to restore health to people. Those who are most in need may not have the necessary resources to access health care, nor may they have the financial resources to pay for care. In this case, services must be provided free of charge or at a minimal cost. Basic health care is a human right, and we must strive to provide universal access to that care. The predominant agency associated with global health is the World Health Organization. Other important agencies include the Centers for Disease Control, the United Nations, and the World Bank, to name a few. The World Health Organization strives to combat diseases, infectious diseases like influenza and HIV, and non-communicable ones like cancer and heart disease. The World Health Organization helps mothers and children survive and thrive so they can look forward to a healthy old age. They ensure the safety of the air people breathe, the food they eat, the water they drink, and the medicines and vaccines they need. The Centers for Disease Control and Prevention is the leading national public health institute of the United States. Its main goal is to protect public health and safety through the control and prevention of disease, injury, and disability. The United Nations played a part in global health with the declaration of the Millennium Development Goals. The Millennium Development Goals were set forth at the Millennium Summit in September 2000. They consist of 8 anti-poverty targets that the world committed to achieving by 2015. Enormous progress was made on the Millennium Development Goals, or MDGs. However, the indignity of poverty continues for many. The Sustainable Development Goals, otherwise known as the Global Goals, build on the Millennium Development Goals. The new SDGs and the broader sustainability agenda go much further than the MDGs in addressing the root causes of poverty and the universal need for development that works for all people. These were adopted by 193 governments. The target date for achievement is 2030. The World Bank is an international financial institution that provides loans to developing countries for capital programs. It is not a bank in the usual sense of the word, but it is an extended family comprised of 5 international organizations. The World Bank has 2 goals. The first goal is to end extreme poverty. The bank's goal is to decrease the percentage of people living with less than $1.90 a day to no more than 3% by 2030. The second goal is to promote shared prosperity. The goal is to promote income growth of the bottom 40% of the population in each country. The health of the U.S. population can be affected by public health threats or events across the globe. Rarely a week goes by without a headline about the emergence or reemergence of an infectious disease or other health threat somewhere in the world. Since the 1970s, newly emerging diseases have been identified at the unprecedented rate of 1 or more per year. Recent examples of this include the Zika virus spread in 2016, Ebola virus outbreak that began in 2014, the 2003 SARS epidemic, and the 2009 spread of novel H1N1 influenza. Improving global health can improve health in the United States and support national and global security interests. Global health issues also include non-communicable diseases. Globally, the rate of deaths from such health problems as heart disease, stroke, mental illness, and injuries is growing. Therefore, many developing countries now deal with a dual burden of disease. They must continue to prevent and control infectious diseases while also addressing the health threats from non-communicable diseases and environmental health risks. Gaps in health status are present worldwide. Every second of every day, 4 women around the world give birth, and every minute, 1 of those women dies. In Sweden, the lifetime risk of a woman dying during pregnancy and childbirth is 1 in 400, while in Afghanistan, it is 1 to 8. Worldwide gaps also exist in health status. Mortality rate is defined as dying between the ages of 15 and 60 years. Afghanistan has the highest mortality rate, with a rate of 242 out of every 1,000 persons. The United Kingdom, however, boasts a rate of just 72 out of every 1,000 individuals. There is no biologic or genetic reason for these alarming differences in health and life opportunity. Adding to these gaps is the inequality in health service that exists in many countries. Even if they could pay, access to doctors would be a challenge. Low-income countries have 10 times fewer physicians than high-income countries. Nigeria has about 4 physicians per 10,000 individuals, while Norway and Sweden have 40 physicians per 10,000. Globally, nurses are in short supply. The United States has a shortage of about 500,000 nurses. India, however, needs 2.4 million nurses to reach a nurse-patient ratio of 1 for every 500 people. One of the greatest needs of area is in midwifery. Many countries in Africa and Asia continue to include midwifery as part of the diploma nurse preparation, although there is increasing pressure for direct midwifery education without a professional educational background. Nurses have the responsibility to view healthcare from a global perspective. This begins by understanding policies and politics of globalization and key international and health and nursing issues. Achieving nursing's voice in policymaking is perhaps the greatest challenge facing the profession in the 21st century. The lack of a strong, united, non-governmental nursing voice in many nations means that nursing continues to be disadvantaged in the policy arena. Advanced practice nurses are sorely needed. Globally, however, practice continues to face a number of hurdles. There is a wide variation in regulation, competencies, and autonomy. Additionally, there is a lack of consistent titles, varying scope of practice and standards, and quality of programs. Despite these challenges, advanced practice continues to move forward. Getting involved in global health begins by cultivating a world view and being sensitive to the cultural aspects of policy and practice.